Welcome back. Well, today I am joined by Dr. Valentina Bonev, who is here on behalf of BreastLink. Well, Valentina or Dr. Bonev, thank you so much for joining me today.
No problem. Thank you so much for having me, Lisa. Good to see you again.
Good to see you too. Now, we've talked about breast cancer before, but today we're going to highlight, some of the risks. And I know for the last couple of years, people have been putting off being checked. And, now I've heard that the cancer rate of people having cancer has gone up primarily, probably because they didn't get it checked early enough and didn't have prevention. Would you say that has been kind of the case and you've seen that happen over the last couple of years?
Definitely. Patients have not gotten mammograms or seen a doctor the last 1-2 years, basically because of the COVID pandemic, fear of coming in to see the doctor. And we are seeing patients presenting later with breast cancer versus an earlier lump or lesion that could be treated minimally with a surgery. And now, unfortunately, some patients are requiring extra interventions such as chemotherapy or more extensive surgeries.
Yeah, that is really frightening because, of course, they were afraid to get COVID, so they didn't want to go, but they would have been better off getting it done because now look what you're saying is really a shame. What constitutes a patient for being at high risk for breast cancer?
Right. So this is a really important topic, and there's a lot of sort of variability, but basically there's the main factors. There's factors you can't control, which is family history of breast or ovarian cancer, your personal history. People may not be aware, but those who received radiation to the chest prior to 30 years old, such as for Hodgkin's lymphoma, actually really increases your risk. Patients who may have inherited a genetic mutation that predisposes their risk to breast cancer. Those are things you can't change. They're non-modifiable risk factors. And then there's modifiable risk factors that can affect your risk to a variable degree. It can be a little bit hard to measure, but patients who are obese, who don't exercise, who eat unhealthy diets, those are going to negatively impact you. But those are things you can change. So therefore, they're modifiable risk factors.
Right. And of course, some of those things, exercise and being overweight really affect so many things and not just, getting potentially breast cancer.
Absolutely.
Yeah. So, once someone has been diagnosed with breast cancer, what are some of the things that they can do at home to sort of monitor themselves or can they have help?
Once someone's been diagnosed with breast cancer, they definitely need to follow up with their doctor, report any changes. For example, if a patient's saying, you know what, now I feel like I'm having headaches or my back hurts, my bones hurt, this is new, then we need to evaluate them for metastatic workup. And that would definitely change how we're going to be managing this patient. Which can be delaying surgery or doing chemotherapy or changing the chemotherapy regimen. So just being aware of your body, if things are changing, if you feel like, you know what, this breast lump, it feels like it's bigger, or now I feel a lump in my armpit, definitely let your doctor know. And again, that can change your stage of breast cancer and your prognosis and treatment.
Now, we've been seeing a lot of commercials lately that been talking about metastatic breast cancer. And so is it fairly common for cancer once you've been diagnosed in the breast to spread, or is that not so common?
So most of the patients are going to be diagnosed with earlier stage, like stage 1 or 2, 3 as well. For the metastatic patients, those patients, either they're young and they have a very aggressive form of breast cancer, or unfortunately, they're those subgroup of patients who noticed a breast lump and chose not to go to the doctor, chose not to get any workup whatsoever. And then once they feel like it's really ballooned up, they'll present to the doctor. And then unfortunately, it can be a stage 4. And there are a lot of medications out there actually that can prolong patients' life. I mean, 10 years plus. So it is pretty amazing what's out there.
Why are people so afraid to come in when they feel something right away?
I think it's part of it is fear of the unknown, uh, fear of, well, am I going to live? Am I going to die soon? Um, just, I think there's just a lot of fear of knowing things, which is interesting because then there's other patients who want to know everything.
Yeah.
There's other patients who don't want to know anything. And I've also encountered patients who perhaps a spouse or other family member or close friend maybe underwent chemotherapy for a totally different malignancy and had a very negative experience, and maybe they were already metastatic disease, so totally different situation, and it really impacted them, and they're afraid to get treatment because they're afraid that they're going to go down this same road, they're going to have poor quality of life for whatever remaining time is left.
Right.
So it definitely emphasizes the family, the friend support, because that has swayed some of my patients to get treatment.
Right. Right. And that's frightening because the patient that they're referring to, or or someone who had the bad experience may have had it like 10, 15 years ago, but we know that technology has changed so
Right.
rapidly
Absolutely.
that just putting it off for like a year just because somebody else, that's
Yeah.
kind of nonsensical in a lot of ways. But I do understand that fear of feeling like, oh, I'm going to feel just like that person. So
Right.
the key takeaway, though, of course, is to make sure you do have your regular mammograms, and anytime you identify something, make sure you did check right away.
Right. Yeah.
Right. Okay. Perfect. Well, thank you so much for the information as always.
Thank you so much, Lisa, for having me.
All right. And we'll be right back after this.